Hi guys, happy Sunday to us all. How are we doing? I hope our day is going well. Okay, last week Sunday I spoke about psychotic disorder and I narrowed it down to delusional disorders where I talked about the different types of delusion, the grandiose, the delusion of jealousy, erotomania, and the rest. Today I'm going to be talking about hallucination. Hallucination is one of the symptoms of psychotic disorder. Hallucination are sensory experiences that appear to be real, but they are actually created by the mind. And there are different causes of hallucination. We have alcohol withdrawal, we have substance use. It could be as a result of mental illness, it could be as a result of physical illness, such as epilepsy, it could be as a result of um, social isolation, lack of sleep, and the rest. We have different types of hallucination. We have the visual hallucination. Visual hallucination has to do with sight. Someone seeing things that are not real or things that appear like some other thing. For example, the person might see a biro and the biro happens to look like a bird. So when other people are seeing a biro, this person is actually seeing a bird. At the same time, the person could see someone that others are not seeing. The person could see things that others are not seeing, and these things are not real. We also have olfactory hallucinations. Olfactory hallucinations has to do with perceiving things that are not real, things that are actually not there. And it's usually offensive odors. So you can see someone perceiving something that is smelling, meanwhile something is actually not smelling. We also have gustatory hallucination, and this has to do with sense of taste. The person tests things that others are not testing. The person might drink water and then the water is kind of sweet in the person's mouth, and this kind of hallucination is very common with epileptic patients. We also have auditory hallucination, hearing things that others are not hearing. You see someone sitting and the next thing the person will just shout yes and then runs to you when you actually did not call the person. We also have tactile hallucination, where you have sensory organs crawling on your body when nothing is actually crawling, but you just feel something is crawling on your body. One might even tell you that there are bugs living inside of him or her, and maybe a person has lice and all that. Meanwhile, those things are actually not present. So please, if you find this kind of people around us, we need to encourage the person, we need to guide the person to seek help, because hallucination can be treated, and it can be treated according to the type, according to the cause of the hallucination. So please, let's watch out and guide people to seek help and not laugh about it. All right, thank you and bye. See you next Sunday.